I'm Carl Angelo S, third-year medical student from MCU. And today, I'll be demonstrating how to perform physical examination of the abdomen, and as well as I'm going to answer the guide question on the case. So this is a case of a 60-year-old previously well woman presents to the ER with vomiting of 1 week duration described as foul smelling and contains possible fecal material accompanied by low back pain and symptomatic anemia. She also experienced alternating constipation and diarrhea with rectal bleeding. Weight loss was also noted. On physical examination, BP of 80/60 mmHg, heart rate of 115 beats per minute, respiratory rate of 24, and temperature of 36.2 degrees Celsius. There is a large palpable mass in the right lumbar region of the abdomen during the palpation. Fresh blood was also noted on the DRE. So first, I'll be demonstrating how to perform the focused physical examination of the abdomen. So magandang araw po, ako po si Carl Angelo S, third-year medical student. Maaari ko po bang malaman yung pangalan ninyo?
Ako si Maria Clarodelita S. Rodriguez.
Ma'am, ano pong gusto nyong itawag po sa inyo?
Tita Flor.
Ano po?
Tita Flor.
Sige po, Tita Flor. Pwede today po papakinggan ko lang po yung tiyan ninyo. Maaari po ba tayong gawin? Sige po. Sige ma'am, pakitaas po, pwede niyo po bang itaas yung paa ninyo kasi importante po to sa ating physical examination. Cover ko lang po So ngayon naman po, pwede niyo po ba itaas yung itaas na damit ninyo? Una ko pong gagawin, titignan ko lang po kung may mga sugat po. So una po, first I'm going to perform inspection of the abdomen. So on inspection, I've seen there's a pallor and also there's an adequate abdomen size. Ngayon, pwede ko po bang i-check yung abdominal, pwede ko po ba i-check yung tiyan ninyo?
Okay.
So the abdominal circumference is 80 centimeters. Also, also, on inspection, there is no presence of lesions, scars, and bulging mass. Okay po ma'am? Okay, tapos ko na pong i-check yung abdomen niya. Ngayon naman po, titignan ko naman po yung tunog, papakinggan ko naman po yung tunog ng inyong tiyan. Okay po ma'am, normal naman po yung tunog ng inyong tiyan. So, on auscultation, the patient, I observed the normal active bowel sound. Next naman po ma'am, okay lang po ba gagawin ko po ito sa inyo? I-check po natin yung tunog ng tiyan mo. So, general on percussion, general tympanism is observed. Last naman po ma'am, pwede ko po bang kapain po yung tiyan ninyo? May masakit po ba? Dito po. On light palpation, there is no tenderness noted. Next naman po, ipapalpate ko po ulit Sabihin niyo po may masakit May masakit po. As well as on deep palpation, there is no tenderness. Sige po, Tita Floribel, okay na po yung physical examination na. Pwede nyo na po ibaba yung damit ninyo. And magpahinga na po kayo. Salamat po. Great. Next. So, this part will be for answering the guide question. So, okay. So first, what urgent measures are required for this woman? So, first, we must address the bleeding of the patient as well as how to control it. We may give tranexamic acid to control the bleeding, and we should give blood transfusion and intravenous iron supplementation so that the level of hemoglobin hematocrit will be normalized. So next, we should also address the level of nutrition status of the patient and hydration. So we should also secure an IV line for the patient, and we should give enough vitamins and minerals for the patient. Second, what other pertinent data should be asked? For this part, first we should consider asking for the family history of the patient. If there is a family member having colon cancer, and how the next is the diet of the patient. If the patient food preference are half cooked or raw foods like sushi or steaks. Next, we should also ask for the personal social history of the patient, specifically the smoking history and history of alcohol intake. Then lastly, we should also ask for the other systemic diseases such as diabetes mellitus, hypertension, or even HIV or AIDS. Next, what diagnostic procedure should be requested at the ER? Basis for requesting. So first, we should request for complete blood count with platelet count to check the degree of the anemia. Also, we should also request for electrolytes, sodium potassium chloride, to check if the patient is suffering from dehydration. Next, we should request for erythrocyte sedimentation rate to check for malignancy or inflammation. Fourth, we should request for imaging status such as X-ray, CT scan, or MRI to rule out malignancy or masses. Then next, we should request for fecal occult blood testing or FOBT to check for the presence of occult blood for the diagnosis of colon cancer. And if it turns out positive, we should also test for the tumor markers such as carcinoembryonic antigen. Ayun. Next question, what are your consideration in this case? Explain. So in this case, my primary consideration is colorectal carcinoma because of the first, considering the age of the patient and the clinical manifestation presented during the in the ER. First of all is the palpable mass at the right lumbar region and the unexplained weight loss. Also, the presence of rectal bleeding and anemia, which is common manifestation in colon cancer. The patient also exhibits foul-smelling vomitus, which is common because there is a obstruction of the rectal region. Ayun po. Next question. What are your differential diagnosis basis? For differential diagnosis, first is ulcerative colitis, and second, Crohn's disease, which are chronic inflammatory bowel disease, and third one is arteriovenous malformation. The first two, chronic inflammatory bowel disease, are both present as nausea, vomiting, back pain, rectal bleeding, and vomiting iron because of the presence of different factors. For example, for ulcerative colitis, there's an inflammation and infection at the GI tract. But it is not enough to consider because there is no imaging studies presented in the case. And then for Crohn's disease, usually Crohn's disease also exhibit the same nausea, vomiting, rectal bleeding, but in Crohn's disease, there should be a bone loss or decreased bone density. Decreased bone density, right? Then lastly, AV malformation. Though AV malformation may present as clinically silent, AV malformation may present in the patient as palpable mass, but more imaging studies must be done in order to confirm or diagnose it as AV malformation. Next question. Ayun, that's all pala. Thank you po for listening.